Real quick intro to our borough president, Eric Adams, who's a Brooklyn native from Brownsville, who obtained his bachelor's in criminal justice at John Jay College and then went on to get a master's in public administration at Marist College. He spent 22 years in law enforcement, retiring as a captain, and then in 2006 went on to 4 terms in the New York State Senate representing Brooklyn. And as of 2016, he took over the very influential and prestigious position of Borough President, following Marty Markowitz, 2 different personalities you could not possibly imagine, but Eric is a force to be reckoned with. I'll leave it at that. He has his personal story with plant-based health, but more importantly, he's been a steadfast advocate in education, in public policy, in healthcare. I was, as part of my plant-based activities, I run marathons, and I was running a few hours 2 weeks ago. I listened to one of my podcasts, the No Meat Athlete, and who are they interviewing? Eric Adams. And I get to listen to him on the No Meat. It was a very good podcast, Eric. I learned something new. It was very good. But Eric is fabulous, and without further introductions, Eric, it's all yours. We really appreciate it. Thank you.
Thank you. Thank you so much. And really, I want to thank the organization for being pioneers as we move forward and deal with healthcare, not just sick care. And I recall what was not mentioned in the brief overview of my bio is that I spent 22 years in the police department, retiring in the rank of captain. And I share that with you because during the early days of my career, we used to often respond to a block or neighborhood where a horrific crime took place, maybe a homicide, a serious felonious assault, a robbery. And the neighbors would say, are they safe? Are they fine? Is it going to be all right? Would their family be the victim of a crime? And we used to say often that everything is fine. You and your family will be okay. And then we would get back in the patrol car and knew in reality we may be responding back to that same block and that person would be a victim of a crime. I didn't realize until I finished my career how much watching what happens to people and reliving trauma over and over actually traumatizes you as well. As a law enforcement professional, upon my retirement, I suffered from PTSD. You think about it for a moment. Every day you're responding to people going through some of the ugly brutalities that man does to man. And it is really challenging after a while. And I thought that, the poor people, and I felt sorry for them without realizing that I needed to look internally because I was impacted. I was impacted, although I went home and my block was not the block where the shooting took place or the robbery or the assault. But in reality, I was living through it just the same. And when we were able to turn around crime in the city, we were also able to just really handle our own stress of seeing that brutality all the time. I share that story because what you are doing is not only for your patients, you are also doing it for yourselves. You cannot have a career in healthcare and watch patient after patient come in, diagnosed with a chronic disease like diabetes. You give them metformin 1 year, then several years later, you give them insulin, and then you see the kidney failure, and then you see the vision loss, you see the limb amputation, the heart disease. You know from the time that patient comes in, they're going to follow this dark hole of healthcare crisis. Patient after patient, and some of you are going to become personally involved with the lives of your patient as you share stories of graduations, marriage, and other incidents and interactions. and you're going to start to actually feel their pain. And you may think you can write the prescription and just put it in a chart and walk away, but that's not true. When you see that Miss Jones, who you have treated for a while, all of a sudden has to start dialysis, all of a sudden must lose a limb or lose her sight, you are going to internalize that. That is going to become part of your psyche. And by the time many of our medical professionals leave their career, if they know it or not, they're suffering from PTSD. They're suffering from seeing trauma after trauma after trauma. And you know it before you started, just as I knew when I told that family they would be safe. I knew, in fact, they were not going to be safe. You know what's going to happen. You know that medicine you're given is only covering up the symptoms. And each medical professional that continues down that path, no matter how much they're able to cover it up, some of them will self-medicate themselves with alcoholism. Some will self-medicate themselves with divorces or trauma or pills, depression. But in fact, without making and connecting the dots, it has a lot to do with our failing healthcare system. It not only harms the patient, but it harms the caregiver, and it harms the medical professional. And so when you take this initiative that you're doing and you're saying that we are going to be the pioneers to change medicine as we know it, to do something different, to go really with the science and not the custom, to push back on the grip that the pharmaceutical industry has on our healthcare system. And just looking at my personal story of reversing my vision loss, reversing the neuropathic nerve damage that I was receiving, and my type 2 diabetes, and my 80-year-old mother, also after being diabetic for 15 years, 7 years on insulin, watching her in 2 months go into a whole food plant-based diet, being cycled off her insulin. How many mothers we could have saved if we just had the right instructions in our medical school, or if we just had the right mission of lifestyle medicine being taught and lived out in the various medical professions throughout this entire city. So I'm excited by what you're doing, because as I look at where we're going in healthcare on a national level, you have taken the question mark of what is going to happen to us, and you have straightened it into an exclamation point saying we're going to be fine. We're looking at a new movement and a new thought. You are going to do the healthcare what Steve Jobs did to the phone. You're going to do to healthcare what other great people have done to so many new inventions and new thoughts. This is a great moment for us as you continue to recruit others who are going to be part of this conversation, as we look at our hospitals and reshape them from a patient of sick care to a place of healthcare, to redefine the term pharmacy from F-A-R-M-A-C-Y to from P-H-A-R to F-A-R, to use plant-based, the thought of growing food. Our hospital rooftops can have rooftop gardens where we can serve healthy food in the cafeterias. You're now the experts that will go into our schools and talk to our principals and other scholars and talk about how we could change the trajectory of 70% of our 12-year-olds having early signs of heart disease, our #1 killer. You can start going into the various adult daycare centers and senior centers and faith-based institutions so we can start having a real conversation around health. Don't underestimate the power of your profession. Whenever I responded to a school, a church, a hospital, and I stated I was a police officer, people sat up and listened. You are part of the occupational profession that people listen to. That white coat, that stethoscope, your pad says a lot to people. It's symbolic of what we believe in America are the positions of authority. You could use that authority in two ways. You could use it to send people into the dark hole of sick care, or you can use it to bring people in the lightness of having wellness and real health care. You're not only going to save the patient, you're going to save the caregiver. You're going to save our country. Our healthcare system is not sustainable. 80 cents on a dollar spent on chronic diseases 30 million Americans are diabetic. 84 million are waiting on deck as pre-diabetic. This is our opportunity to change an unsustainable state to make it sustainable. And in the process, we're going to prevent families from experiencing the PTSD that I experienced when I lived 22 years of trauma as a police officer. They don't have to live that trauma as a patient and you as a healthcare professional. So again, I thank you for what you have done, what you are doing, and what you will do for the future of healthcare in this country. Thank you.
Thank you. And we have some time for questions. So feel free to chime in if you have a question on mute.
I'd like to say something. I'm usually pretty shy, so I'm going to come out of my shell here.
Just introduce yourself, Mary.
I'm Mary Uter. I was a nurse at Bellevue Hospital for 13 years. I was at the first Breaking Bread Building Bonds dinner. So shout out to you, Eric Adams.
Thank you.
And thank you for all you have done for our city. And I just have to expand on what you said as a healthcare worker, the trauma that we face. And one thing I would like to say that's very important for these doctors is bedside, I noticed doctors, and they focused on one organ. So we had the liver specialist, the kidney specialist. Remember that that patient is the whole patient and everything works together, and look for your root causes behind everything. And also, we do need to move more toward a system of healthcare versus sick care. And my parting little line here is the standard American diet leads to the standard American diseases, which lead to the standard American medications. So let's try to break all those apart and look at our root cause and step it back on taking a look at our patients. And thank you again.
Thank you.
Thanks, Mary. I'm going to slip in a quick question if I could, and it has to do with COVID, which I think if ever there was a disease that highlighted the importance of taking care of yourself, it's probably COVID. And I sent in 3 letters to the editor, to the Wall Street Journal, trying to get them to print something about how important it was to take control of your life, eat right, exercise. Now is the time. And that's the best way to fight COVID and other problems. They didn't publish any of them. They didn't seem too interested in that stuff. But I'm curious, President Adams, how has the COVID sort of spotlight, especially the health disparities that it's emphasized for, people who, for Blacks, Indigenous, people of color, in terms of having disproportionate chronic diseases, mortality, how has that influenced your thinking about plant-based health and lifestyle medicine?
It has impacted it a great deal. When you look at the fact that 90% of the people who transitioned from the physical to the spiritual had pre-existing conditions, and over 90% of the people who were hospitalized had pre-existing conditions and comorbidities. And we should have used the opportunity during the peak of COVID, as we were feeding people, we should have fed them healthy meals. I thought it was a lost opportunity when we could have gone into the various places that we were delivering meals and made sure that they were plant-based meals. It would have served 2 purposes. One, it would have strengthened the immune system of people who was dealing with conditions, and we would have had a rapid turnaround from those active issues that people were dealing with, such as asthma, diabetes, and other chronic diseases. And we didn't do that. And what happened with your desire to send an article or op-ed to the newspapers is what we saw all over the entire country. We were more inclined to talk about the deaths without talking about how do we prevent the deaths. And it's really sad to see the unwillingness to think differently about how do we really prevent some of our chronic disease. Our healthcare system must be, we must have intervention and prevention. We know how to do the intervention and go in with someone who's dealing with the chronic disease. Now we need to move to the place of prevention, and that is something we are reluctant to do.
Thank you. One of the letters I sent to them was in response to Jason Gay, who's a very good writer for the Journal. And he had written a piece about how now is not the time to worry about your beach body, that it's okay to be chubby and fat because we're all inside. And I kind of wrote back and said, this is exactly the time to worry about your beach body.
Right.
Because if you get COVID, you're going to do a lot better. Even a few weeks on a whole food plant-based diet has an impact on hemoglobin A1C, on lipid markers, on inflammatory. So it really is interesting. Other questions for our borough president?
Thank you so much, President Adams. That was a very moving presentation. And I never thought about the PTSD that physicians can go through. I've heard about physician burnout. And on the reverse side of that, I've heard that some physicians kind of restore their optimism after they start practicing more plant-based medicine. And that's a great win-win for everyone in that situation. My question is, how do we inspire maybe medical students and people in training now who, are going through the training as it exists and don't realize, like, at the end there's going to be some kind of sense of not feel of powerlessness in the end. Like, how do we catch it before it gets to that point?
That's a great question. That's a great question. I think that there's a great opportunity right now with this movement called Black Lives Matter. We are pushing a great deal of items on our college campuses, in our hospitals, and other areas. I think healthcare professionals should line up with this movement. This movement has the wind at its back, and you should be extremely vocal, particularly a group like this, and talk about if Black lives really matter. Then we need to look at what is happening to Black lives in our hospitals. And that is a way to really start engaging this conversation. There are topics taking place all over the country about what Black Lives Matter means. We see a short space where it's talking about the health crisis. And I believe, coming from healthcare professionals demanding that our medical schools start to engage in real preventive medicine, I think there's a real room for it. And lastly, again, don't underestimate, I should say, the power of your profession. It means a lot to have that DR in front of your name. That title is a symbol of strength in America. I think about mothers want their children to marry a doctor or lawyer. Nobody's saying when you get married, make sure you marry a borough president. They think about your profession. Your profession means a lot. Use the power of your profession and continue to grow your organization and start being vocal. Hold press advisories, do op-eds, send communications to incoming medical students, hold meet and greets for incoming medical students when you come in and introduce them to plant-based. Because I think the greatest betrayal that has ever taken place in this country is what we're doing to young people who want to be a doctor all their lives, practice on their little brothers and sisters or cats when they were growing up because they thought they were going to save lives, just to get in the system and be betrayed. Not only aren't you saving life, but you're giving people procedures that is actually going to shorten their life.
Anyone else have a question? Go ahead. Who's speaking?
Okay. Hi, this is Alex. Thank you so much, President Adams, for the presentation today. Appreciate it. I just had a quick question about your introduction to the whole food plant-based diet. Was this something, I was just wondering how you became introduced to this and your transition to the diet? Was it something that was more gradual or something that was rather all at kind of once?
Yeah, great question. after going to 5 medical professionals in the city that told me that there was nothing I can do, this was my new norm. I would be on medication the rest of my life, including insulin, including a medicine for so many, you can back up in that spot. Medicine for my eyes, vision loss, nerve damage, ulcer, high blood pressure, high cholesterol, all these different items. I was having medicine for all of them. And instead of embracing the theory that I was going to be on these medications throughout my entire life, I went to the computer and I typed, instead of living with diabetes, I typed reversing diabetes. And that's when I came in contact with some great doctors like Dr. Greger, Dr. Esselstyn, Dr. Barnard. And I decided to go see Dr. Esselstyn down in Ohio. And he was the one that introduced me to plant-based. The first 3 weeks of going plant-based, as soon as I came back to the city, that's when my vision cleared up. And I just went, as one would say, a cold turkey food instead of cold turkey, you know. And it was just, the first week was troubling, challenging. You know, I was changing a 56-year living and eating regimen. But once I sat down on that Sunday at the end of the week and talked to myself and said, listen, lean into this. See this as a learning experience. And instead of looking at the food I couldn't eat, I started looking at the food that was open that I could eat. And it took me on a different journey, everything from new spices to new ways of cooking. And it just really just opened my eyes to what I was missing and not what I was going to miss.
Yeah, that was a great question, Alex. And the key word that President Adams said there is that word reversal. Most health professionals think of diet as a way to maybe limit progression or reduce some medication needs, but this concept of reversal with nutrition and diet as a primary intervention is not widely accepted. And ACLM, I was mentioning to Rachel earlier, next week we're actually starting, we have a panel of about 20 national experts from all different societies, nutrition, endocrine, surgical, medical, everyone. And we're going to be working on some expert consensus products for reversing diabetes with whole food plant-based diets. It's really going to be quite fascinating. I happen to be chairing it, and I think it's going to be very, very exciting. Hopefully in about 6 months we'll publish something. But this reversal is key. And I have to say, you were very forward thinking, Eric, to use that word reversal. It makes all the difference. Maybe we have one last question, and then I know the president has a tight schedule.
Mr. Adams, I had a question. First, thank you for your presentation. It was very inspiring. And my question, so I'm one of the social media chairs for the Lifestyle Medicine group. And as part of the group, we're always thinking of sort of creative ways to try and engage the community. And I was wondering what your thoughts are on, effective ways to reach the community where they are, and also what your thoughts are on engaging local businesses in taking part of this movement.
Great question. First, I'll deal with the local communities. It is so important to me, and I say this often in government, communication is not merely because someone says something. It is really making sure what you said is reaching the ears of the people in the manner in which you want it to be heard and understood. And you have to meet people on their level, use their various methods of communication and receiving information. And that includes local papers, op-eds in their language. In Brooklyn, 47% of Brooklynites speak a language other than English at home. As we talk about healthy food, we should take that into account. And then find ways of creating good tasting nutritional meals that are culturally normal. If you want a taco, if you're in the Mexican community, there's ways of making some great meatless taco, making whole wheat, real 100% whole wheat tacos. The same in any community. Southern food, you know, you do not have to give up good taste and good visualization to enjoy the meals that you're doing. And so we need to really understand the cultural norms of community, respect those cultural norms, and show people how to transition into a healthy lifestyle by identifying those cultural norms. And then local businesses. I believe the city should incentivize more, encourage using of pharmacy bucks where people can get prescriptions to healthy food instead of just medicine, to vegetables, fruit, etc. And that is ways you can empower businesses to start carrying the right products so we can start producing in some of these food deserts or food apartheid, some healthy meals.
Thank you.
Thank you again. Thank you so much. And I really appreciate what you're doing. I'm excited about what the future is holding in medicine.
Thank you.
Thank you, Doctor.
Have a
Thanks
great
so
rest
much.
of the day. All right.